Good morning, everyone. Welcome to Center of Balanced Life. My name is Kenny, the acupuncturist and Chinese medicine herbalist from Center of Balance. Today's topic is about arthritis in knee, and which acupressure points could be helpful for this type of condition. Please help us out by liking and sharing this video for those who might benefit from our daily free-for-all acupressure self-treatment. Do you know anyone who suffers from arthritis in knee? If you do, please reply 1 and definitely save this topic. Let's get one of these 3 tools ready. It could be your fingers, which is your thumb, your index finger, or your middle finger. And please make sure you cut your nails. Knuckle. With the index finger bending down and thumb supporting it. A massage device or some small rounded tool, not sharp, please. Do you know there are over 100 types of arthritis? Let's differentiate the most common type. One is the osteoarthritis, or we can call it OA. Can develop due to normal wear and tear in the knee, particularly in the people who have a family history of arthritis. This chronic condition happens when the cartilage between the bones wears away, reducing cushioning and shock absorption to the point that the bones begin to rub against each other. Number 2 is called the rheumatoid arthritis, or RA, which is an autoimmune disease, meaning that the body immune system attacks its own tissue lining around the joints, causing inflammation and chemical reaction that over time damage all the surrounding tissues such as bones, cartilage, tendons and ligaments. With this chronic disease affects multiple joints throughout the body. It usually start in the smaller joints and affect the same joint on both sides of the body. Number 3 is the post-traumatic arthritis, which develop over many years from the initial injuries, direct injuries to the cartilage or the delayed wearing of the cartilage due to change in the way that bones move together, such as the torn meniscus, ligament injury or knee fractures. Symptoms of knee arthritis can be a sudden or gradual increase in pain. And with rheumatoid, the pain is more noticeable in the morning or after inactive for a while. With OA, the knee pain that can wake you up from sleep. Swelling or tenderness. The arthritis of the knee can cause inflammation. With RA, you notice more swollen joint along with possible fever, tiredness, general feeling of being unwell. With OA, the symptoms can vary and has direct impact on the affected joint, and it could be a hard swelling due to the formation of bone spurs, the soft swelling as an inflammation that causes the extra fluid to collect around the joint. Swelling may be more noticeable after a long period of inactivities, like when you first wake up in the morning, or that's more of a RA, right? The buckling and locking, cracking or popping sounds over time because of damage to the joint, and then that could cause the knee structure to become unstable, which could cause give away or buckle. With RA, the damage to the tendons, which will affect the knee stability. Both OA and RA can result in cartilage damage which causes the rough surface and bone spurs to develop. As you try to move the joint, these irregular area or the rough surface can start rubbing against each other. That's when you can start hearing the grinding sensation, grinding noise, the cracking or popping sound when you try to bend or straighten the knee. And obviously it will be hard to bend straight outright. And with that will also affect the poor range of motion. That's not the signs and which are the symptoms of it. The deformities of the knees. The shape and the appearance of the knee can change due to a flare-up and as damage progresses. The knee deformities range from not so noticeable to severe and debilitating. In RA, the swelling and redness are quite common during a flare-up. Over time, the persistent inflammation can cause the permanent damage to the cartilage and also the surrounding tissues or the tendons, right? With RA, the muscle around the knee get weakened, resulting in possible of the sunken appearance, and then the knee can start to point toward each other or bend outward. With arthritis, your knee may hurt when you're climbing stairs, when standing up from a sitting positions, walking on a flat surface, sitting down for a while. And possible factors that could cause worsening of the symptoms such as cold, windy, wet weather, stress, too much inactivities. In traditional Chinese medicine, we consider whether a problem stems from internal or external factors, and it belongs to the disorder what we call a B syndrome. The cause of B syndrome is attributed to pathogenic factors such as wind, which will give no fixed pain, meaning the pain can jump or move from joint to joint. With coldness involved, cold wind with dampness from external sources, which can cause stiffness, pain that's more dominant, and feel worse with coldness or windy day, but improved by applying heat. Of course, with coldness, it can lead to poor circulation and pale skin. This is why you want to avoid sitting down or being out in the cold, damp weather for a long period of time because of the cold stagnation that can take hold in the joint. If dampness involved, or give the symptoms of fixed pain, swollen, heaviness, sore and achy joints and limbs, possible of numbness, heavy sensation in the limbs affecting movement, and then the tongue coating could be white or greasy. And with heat, the pain could cause some redness as well around the joint. The warmth, the swelling in the joint, which can be improved with the cold. Maybe the arthritis could also caused by internal problem that was congenital, meaning a person was born with it, or the common internal pattern could mainly involve liver and kidney deficiency, with symptoms such as the chronic lingering pain, forelimbs weakness, heavy and achy joint, and most noticeable numbness or weak physique. Some tips of for preventing arthritis and pain management according to Chinese medicine. One could be you avoid cold food and drink, because cold food or drink can affect the qi and blood circulation of the body, which will also lead to possible dampness formation that can accumulate in the body or the joints and can worsen the symptoms of arthritis. Number two, you keep the joints warm. Of course, not in case of the arthritis due to heat. So the warmth can prevent poor blood and qi circulation. Number three, you want to engage in appropriate exercise to strengthen the muscle around the joint, such as swimming, and because that could possibly cause least stressful on the joint. Number four, stretching exercise that help maintain the flexibility and to improve the range of motion. Of course, not all patients with arthritis will experience same symptoms. When they do occur, the severity varies. For some, the symptoms are not constant but may come and go depending on the level of activities and other factors. Let's see how well Rio responds to acupressure points that I'm about to demonstrate. If your pain is on the right knee, please go to your left elbow. If your pain is on the left knee, please go to your right elbow, vice versa. If opposite side does not work well, try the same side, please. Now the first area I'll show you is you flex your elbow on the outer side. You find the end of the elbow crease line right there. If you flex the elbow, you can see end of the crease line here. Okay, around that area you palpate, you locate the sensitive or sore spot nearby. Okay, once you find one, okay, this one, so please press firmly and rub for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You release and rest for 5 seconds, and then you press the same spot again. Firm rub for 10 seconds, release and rest for 5 seconds. Okay, you can repeat this process 3 to 5 times. The next point, elbow flex still. This time you find the tip of your elbow and you move upward. Okay, move upward, you palpate and locate the sensitive or sore spot nearby. Okay, I found one, and then you please press firmly and rub for 10 seconds. Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You release and rest for 5 seconds. Then you press the same point again, firmly rub for 10 seconds, release and rest for 5 seconds. Repeat this process 3 to 5 times daily. And then between these 2 points, right, one's at the end of the elbow crease, one is just at the tip of the elbow crease. Between these 2 points, you might even palpate around. Okay, you may locate more than one sore spot. That's great. Then you just, according to that sore spot or where it is, you press firmly and rub for 10 seconds. Okay, release and rest for 5 seconds. Then you press again. You repeat this process 3 to 5 times. Right, the next point, you continue to flex your elbow, but this time we move to the inner side. Okay, that was the outside and the top, and now we move to the inner side. Now you find the bony thing, this bony thing 1, and bony thing 2, which is just your bone, right? Okay, and then you come between these 2 bony things. You palpate and locate the sensitive spot nearby. Usually it's between the 2 bones. Okay, and once you find one, press firmly and rub for 10 seconds. Release and rest again. Repeat this process, okay, 3 to 5 times daily. Be mindful though, this point is near the funny bone, so it can feel a bit strange, so please don't press too hard. Again, this time between these points and between the bony things and the tip of the elbow, between these 2 areas, you palpate around. You may locate a few more sore spots. That's fine. Then with that sore spot, just press firmly and rub for 10 seconds. Okay, and you release, you rest for 5 seconds, you go back and press firmly again for 10 seconds. Okay, you repeat this process 3 to 5 times daily. Don't worry if these tips not giving you much relief. Knee arthritis caused by a combination of factors. It is very important for us as a traditional Chinese medicine practitioners to do an initial examination to assess and identify which organ system is or are out of balance to come up with a specific treatment plan just for you. So please don't hesitate to call us or email us info@balancetcm.co.nz to book an appointment, or check out our website www.balancetcm.co.nz. My name is Kenny. That's all from me today. Thank you for joining us. If you enjoyed this video, please give us a thumbs up, like and share. Look forward to seeing you guys again. Stay awesome and stay positive.